Be moving on to item number 20, which is a resolution recognizing the 100-year anniversary of the Public Health Department. And I'd like to ask Dr. Penny Bornstein to come to the podium, and Supervisor Gibson will be doing the honors.
Thank you, Mr. Chairman. It is my distinct pleasure to read a resolution recognizing our Public Health Department on the centennial of its service to San Luis Obispo County. Resolution reads as follows. Whereas the County of San Luis Obispo holds a vision of a healthy community for all who live here. And whereas the County of San Luis Obispo Public Health Department has served this community by protecting and promoting health for 100 years. And whereas the department's work over the last century has supported the community's well-being through natural disasters, epidemics, emerging threats, and time-worn challenges, as well as through the development of health-promoting initiatives that have extended life expectancy and quality of life for residents. And whereas the County Board of Supervisors matched $5,000 in funding from the Rockefeller Foundation to establish the Public Health Department in 1923. And whereas in the 1930s, the Federal Social Security Act established public health maternal and child health programs, which continue to this day in supporting a healthy start for our youngest residents. And whereas in the 1940s, the influenza vaccine became available to civilians for the first time and is now given annually to protect the health of tens of thousands of county residents. And whereas in the 1950s, the Public Health Department moved to its current home at 2191 Johnson Avenue in San Luis Obispo. And whereas in the 1960s, the San Luis Obispo Public Health Laboratory expanded its staff to include 3 microbiologists, and today the lab serves as the Laboratory Response Network Reference Laboratory for the identification of biologic agents of terrorism for San Luis Obispo, Santa Barbara, and Ventura counties. And whereas in the 1970s, the Public Health Department responded to what was known at the time as the greatest rabies epidemic, and today collaborates closely with the Animal Services Division of the County Health Agency to prevent and respond to diseases that affect both animals and humans. And whereas in the 1980s, the virus that causes AIDS was first identified, and together the Public Health Department and today, the Public Health Department continues to provide services to prevent the spread of this virus and follow up with every person in our county who receives an HIV diagnosis. And whereas in the 1990s, San Luis Obispo became the first U.S. city to protect public health with a major public smoking ban. And today, public health teams work alongside parents and educators to protect young people from the harms of vaping. And whereas in the 2000s, the San Luis Obispo County Medical Reserve Corps was created in response to the H1N1 pandemic, and decades later, hundreds of Medical Reserve Corps volunteers were mobilized to respond to the COVID-19 pandemic. And whereas in the 2010s, the county's emergency medical services team became part of the Public Health Department, which today leads the planning, implementation, and evaluation of the countywide emergency medical services system and assures a well-coordinated medical and health response to disasters. And whereas in the 2020s, the Public Health Department responded to the COVID-19 pandemic, the Mpox pandemic, and outbreaks of norovirus and other infectious diseases while maintaining a wide range of services for the community to prevent illness and protect long-term health. Now, therefore, be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby recognize the Public Health Department for 100 years of service to our county and for ongoing work behind the scenes to create a healthy community for all who live here. Yeah.
So with apologies for a not-so-short video, but hopefully you can take a nice trip down memory lane, and it does go through each decade. We're going to show about 10 minutes ready to go, and then I'm going to have just a few comments after.
Our story begins in the 1920s when the Public Health Department was created here in SLO County. At the time, we were emerging from World War I, where illness spread quickly in trenches, and from the influenza pandemic of 1918-1919, which killed more than 50 million people. We saw efforts to protect and promote health at the state and national levels, including the public health programs that today provide life-changing physical and occupational therapy to children who have disabilities or special health needs. What we now know as the Public Health Department opened as the County Health Center in 1923. It was funded with a $5,000 grant from the Rockefeller Foundation, matched by the Board of Supervisors. In the 1930s, we saw a great need and effort to address the spread of infectious disease, particularly tuberculosis and sexually transmitted diseases such as syphilis. The California Association of Sanitarians was created in 1930, laying the groundwork for the field we now call environmental health. The New Deal and the Social Security Act created initiatives to support health, such as maternal child health programs that continue today. This decade brought a much-needed campaign to address STDs. Artists hired through the New Deal created education materials, while local health departments provided free testing and treatment. Our own public health laboratory identified more than 400 cases of syphilis in 1939 among a population of only 30,000 residents. For comparison, we recently alerted the public to a spike in syphilis when we identified about 100 cases in 2022, with a population of more than 280,000. In the 1940s, one of the parents' biggest fears was the polio virus. SLO County received its first iron lung to help polio patients breathe. It was delivered in a dramatic 5-hour drive from Oakland under escort of the CHP. In 1943, the first recognized episodes of smog occurred in Los Angeles. People thought the city was under a chemical attack. As a result, the California legislature enacted the first air pollution control law authorizing county air pollution control districts. In addition to the horrors of the Holocaust and the violence of World War II, health officials in the 1940s also worried about infectious disease. They wanted to prevent an influenza outbreak similar to what we saw in World War I and wanted to prepare in case a virus was used as a bioweapon by enemies. As part of this effort, we saw the development of the influenza vaccine, first available to service members in 1945 and to the public in 1946. Many of this generation was still freshly feeling the loss of family members to the influenza pandemic of 1918, so the availability of a flu vaccine was especially poignant. The 1950s brought the development of the first polio vaccine. In 1952, the SLO County Health Center moved to its current home at 2191 Johnson Ave. Reports show the team at the time was excited about having expanded parking options, much like our conversations today. A report shows the building and equipment cost at a total of $120,000, a price we couldn't come anywhere near today, even accounting for inflation, as we deal with cramped conditions and space concerns. 1 year after the move, our public health laboratory received official state approval. Today is one of the most highly respected public health laboratories in California and serves as a laboratory response network reference laboratory for the identification of biological agents of terrorism for San Luis Obispo, Santa Barbara, and Ventura counties. In the 1960s, as the birth control pill became available nationwide, our local public health clinics began offering family planning services. In 1965, Medicare and Medicaid programs brought healthcare coverage to millions of Americans for the first time, and the first record of a well permit was issued in SLO County in 1965. Well water safety was at the top of mind at this time following an outbreak of typhoid fever linked to a water well in Napomo. After 4 cases of typhoid fever were confirmed in the early 1960s, the county health department found that wastewater was seeping into the drinking water supply. Some wells were located less than 30 feet from septic tanks. Today, our environmental health team issues permits for private water wells and provides education to well owners to help prevent the spread of disease through groundwater. The 1970s brought increased awareness of the connection between environmental factors and health. The EPA was founded in 1970, and the permitting of private wells became a function of public health. Lead poisoning prevention efforts reached a milestone with the introduction of unleaded gasoline and banning lead in children's toys. In 1979, the County General Hospital celebrated its 100th anniversary, and local officials received a letter of congratulations from President Jimmy Carter. One of our nation's most important programs to promote the health of the next generation began in this decade. The Women, Infants, and Children's Program provides nutritious food to pregnant mothers, infants, and young children. Today, our WIC team provides support to young families, including breastfeeding education, one-on-one counseling, and connection with other services. The 1980s began on a hopeful note for public health as the WHO announced the eradication of smallpox. This decade saw the first personal computer arrive at the Public Health Laboratory. In 1980, legislation created the Emergency Medical Services Authority, which today continues as part of the Public Health Department. This decade also saw the first voter-approved tobacco tax to fund health education, bringing the launch of tobacco control programs as we know them today. Despite these promising signs, the decade came to be defined in large part by the devastating impact of HIV and AIDS, with the first official reporting of this disease in 1981. The public health community nationally and locally began responding to HIV and AIDS as advocates urged more awareness and action to stop the spread of disease and develop effective treatments. Demand for HIV testing through the Public Health Laboratory increased from 50 tests per month in the mid-80s to 600 tests per month by the end of the decade. Today, public health provides services to prevent the spread of HIV and follows up with every person in our county who receives an HIV diagnosis. In the 1990s, the Clean Air Act put more pollution protections in place, and San Luis Obispo became the first U.S. city with a major public smoking ban. The SLO Air Pollution Control District departed from the Public Health Department and became its own entity. In 1996, the SLO County CUPA program got approval from Cal EPA and the Board of Supervisors. Today, this team inspects more than 1,200 hazmat facilities each year. The 1990 amendments to the Clean Air Act addressed 4 environmental factors that can impact health: acid rain, urban smog, toxic air pollution, and the hole in the Earth's ozone layer. This act also resulted in banning leaded gasoline for cars. The early 2000s saw changes to the local healthcare landscape. The County General Hospital closed in 2003, and in 2004, the county contracted its family care clinics to the community health centers of the Central Coast, and the county's oral health program was established. The Public Health Department, with the support of the Board of Supervisors, opened its doors to the SLO Banger Syringe Exchange Program, which continues to operate today. The SLO Medical Reserve Corps was also founded in this decade. One of the most impactful public health programs to launch in the 2000s was the Nurse Home Visiting Program, sometimes called field nursing. This program connects a skilled home visitor, most often a nurse, sometimes a licensed health or social service professional, with parents and young children in need of support. All programs are voluntary, supportive, and non-judgmental. In the 2010s, the County Medical Service Program downsized significantly as health insurance became available to most residents through the Affordable Care Act. The Emergency Medical Services Agency became part of the Public Health Department, where it continues today. Our public health team received national attention for its part in a coordinated response to an outbreak of valley fever among workers constructing a solar farm in SLO County. Our local injury prevention program began in this decade with work to bike and pedestrian safety, child passenger safety, senior fall prevention, and more. This year, our injury prevention program was selected as one of 7 in California to receive funding through the California Healthy Brain Initiative for work focused on brain health and cognitive aging. The 2020s began almost immediately with the arrival of COVID-19 in our community. While every hour felt long in those early days, we are now able to look forward with the perspective that we are still quite early in this decade. COVID-19 is not all that happened in these few years. We collaborated with leaders on our local LGBTQ+ community to respond to the Mpox outbreak and have been able to keep the number of cases in our community to 1. We also saw our Paso Robles Public Health Clinic open in a new space we share with our colleagues at Behavioral Health and next door to the Department of Social Services, providing a one-stop resource for North County community members. This decade has been defined so far by our community's response to COVID-19. Since early 2020, Public Health distributed more than 108,000 N95 masks. Our lab has processed more than 63,000 COVID-19 tests. 161,000 vaccines were administered at our mass vaccination clinics from December 2020 through June 2021. We have gotten to this point thanks to years of preparation and the protection of vaccines built on decades of foundational research. I think about our peers 100 years ago, 50 years ago, with gratitude for the groundwork they put in place. All this work I've described to you today as the work of the Public Health Department is in fact the work of your neighbors. It's the work of community members who have moved us to a place where we live longer lives with quality of life for many more years. I thank everyone who is working today to build a healthy, slow county for the next 100 years and beyond.
Thank you, members of the board. I didn't introduce myself, Penny Borenstein, County Health Officer and Public Health Director. I first want to say thank you for tuning in, and hopefully you found something that piqued your interest or tickled your fancy. A lot of good material there. And so with that, I want to say thank you to the people who were instrumental in putting the video together. I just want to take a moment to thank Tara Kennan, whose incredible wordsmithing was behind the scenes. Kelsey Elliott and Sam Perez, who went to the History Museum many times and got most of that archival information, and Frankie Van Hoosier, who is our music overlay and technician. So thank you to them. And of course to the men and women who are here today from the Public Health Department, who represent just a small portion, because the others are busy doing a lot of things like covering our front desks, seeing patients in clinics, performing lab tests, environmental health folks in the field doing inspections, teaching health education classes, or in homes as we speak, doing home visits with high-risk pregnant women and their young children. So you're seeing a small portion of what we represent, 230 some odd strong. They do this not for the glory or the money, they do it because of their passion and caring and commitment to public health. And they want to give back to the community. Many times I've been involved in people who we're offering jobs to who struggle with the decision about whether or not they're going to come on board for a pay cut. Or people who are in our staff who, with each cost of living increase, where it's not commensurate with the cost of living increases that we provide, struggle with the decision about whether they're going to stay. But they all do come aboard, and they do stay because they say, I want to work for public health. It's an admirable profession and really wonderful. So we don't have uniforms, though you miss the little white hats on the nurses. Even on Halloween, I don't see any. But anyway, but we are every bit as much officers in safeguarding the public's health and well-being. So. To my colleagues, I wish again to say thank you for the honorable work that you do every day to better the lives of our community. For the past 30 to 40 years, have you heard, for some who have that kind of a tenure, or for some who are newer and just joining us today, but we will work hard and passionately into the future. We have an amazing 100-year history, and will continue into the next 100 years and beyond. With that, I want to thank you.